Hello again, everybody, and welcome to this brief presentation where I'll be talking about social networks and aspects of disease control. I'm Dr. Michael T. LeVasseur, and I'm a professor of epidemiology and biostatistics at Drexel University's Dornsife School of Public Health. So let's just begin by talking a little bit about network theory. Social networks are connected in a variety of ways. For the purposes of this microsimulation that I'll be presenting today, I'm really just focusing on three different types of networks. In particular, we'll be looking at this fully connected mesh, which might approximate what a family might look like, where every individual is connected to each other individual socially. We have a more centralized network, which you might imagine to be like a bar, where there's a bartender that everyone is connected to, but other people are not necessarily connected to one another. And then a more distributed network where each person is connected to two other people or three other people. And this might represent more of an office setting. Now, each individual here represents what we call a node or a vertex in social network theory. And each line represents an edge. Just to give you some of the vocabulary of social network theory, it's all based on graph theory. None of this is stuff that you necessarily need to know, but you might see this come up in some other conversations about social networks and the spread of infectious diseases, especially respiratory diseases. For the microsimulation that I'm going to be showing you all today, I've added an additional family cluster over here, patients 6, 10, 12, and 11. I've also provided everyone with unique numbers so that we could refer to them throughout. And I've added additional connections between people, so you can imagine patients 1 and 10 are children that go to the same school, maybe they're in the same classroom. For their patients 6 and 12 are married to one another, and patient 12 works in this office building over here. Imagining these things in this manner will allow us to see the effects of some of the policies that we may put in place in order to prevent future spread of disease. Before we move on, I want to talk about a couple of the assumptions. So this is a simulation. I've run all of these numbers. Here on the right, you can see a grid of the patients, 1 through 20. Whether or not they'll be symptomatic, so patients 10, 17, and 20 will not show symptoms. That represents about 25% of the population being asymptomatic. And then we have 30 days that we'll be simulating over time. Each of these ones indicate whether or not that person will become infected if they are exposed to the disease. Networks congregate in assigned relationships every day in this network. So if an individual goes to the bar, they go to the bar every day, and it's the same bartender at the bar every day. All families are connected to one another every day. And that is not necessarily true in the real world, but for the purpose of the simulation, we're really just trying to make things as easy as possible to show you what things look like. We assume that individuals become infectious after 3 days of being exposed. We have individuals will develop symptoms after 6 days of infection. We also assume that there's a secondary attack rate of 15%, and that 25% of the population is asymptomatic. Now, the secondary attack rate is something that we've seen quite a bit in the literature. I don't actually approximate a secondary attack rate of 15%. I say that on any given day, each individual has a 15% chance of being infected. This is a more deterministic approach to a simulation rather than a stochastic process. There's a substantial difference between those two, but because it really works for my simulation, I'm going to keep it up this way, but keep in mind that I'm way overestimating the number of infections in this cluster. But I'm doing so just to showcase what spread in networks looks like. So we could look at our first scenario wherein we just do nothing. Life continues as normal and the infection continues unabated. So we start off, and all these simulations are going to be using the same data that I showed you in that table before. So the very first patient who is infectious is patient 2. They were infected 2 or 3 days prior to what we're referring to day 1, but since not much happens then, I'm just showing you the start of that infectious period. Down here at the bottom, you can see this legend. The color black indicates that an individual is susceptible. Blue indicates that they've been exposed. Yellow means that they've become infectious. Orange means that they are now symptomatic. And red indicates that they are deceased. And here on day 2, individual 2 has passed the infection on to family member 4, individual number 4. This is the first infection that has occurred in our simulation. And then we'll see what happens on day 3. Individual 2 suddenly becomes symptomatic. They develop a fever or begin coughing. And on this day, individual 3 becomes infected. So you can see that as time goes on, people are going to continue being infected and change between states. And I'm going to just sort of play through this scenario and provide some play-by-play, if that's what you want to call it, as we move forward. So here on day 8, individual 3 has now infected individual 7, who is the first person outside of the family cluster to become infected. It happens to be the bartender. On day 11, the bartender becomes infectious and goes on to pass the infection on to one of his clients, individual number 9. And here on day 12, individual 1 has passed the infection on to his classmate, his or her classmate, individual number 10. On day 15, individual 10 has passed this on to individual 12, who is the first person in the office building network to become infected. On day 16, since individual 10 was randomly assigned to be non-infectious, asymptomatic, this individual will continue to be infectious but not develop any symptoms. Here on day 17, patient 2, our index patient in this cluster of events, has passed away. I think this is an important moment to consider. On February 29th, we saw our first death in the community spread in that cluster in Washington State. And at that point, we were already this far into whatever epidemic was happening, whatever community spread of this virus was happening. So there was quite a bit of community spread occurring prior to us being alerted that we had a substantial problem in the United States. I think it's important to point out that even by day 22, individual 5 has not become infected. This is just by chance alone, but this is starting to spread quite rapidly throughout the office building, although not necessarily as rapidly as it did in the family cluster. So by day 27, we only have 3 people who have not become infected by this virus. Again, the virus we're talking about, in particular COVID-19 SARS-CoV-2, is not as infectious as this simulation is making it seem to be, but for the purposes of this microsimulation, I just wanted to show you how this could spread. So if we do nothing, infections, especially respiratory infections, can spread quite rapidly throughout populations. So let's explore some of the policy effects that we have put in place here in America and certainly around the world to try and prevent the continued spread of a respiratory disease in our communities. So if we implement school closures, small business closures, and work from home orders and encourage social distancing so that people aren't going out and spending time with friends and family outside of the household unit, we could see that has a substantial effect on the network itself. These red lines indicate things that modes of transmission that would have occurred had these things not been put into place. And so when we move into day 1, we could already see that all of these networks are substantially diminished in terms of, this entire cluster is just sort of broken down. And we start off once again on day 1 with individual 2 being infectious. And let's just see how this plays out. So by day 5, everyone that can be infected, meaning all of those, there are no routes outside of this network, have been infected. That means that we've achieved burnout. So the virus has infected everyone that it possibly can, and if we just quarantine this one family, then once they finally recover and become non-infectious, then we will have successfully eradicated this virus from this particular community. Now that doesn't mean that it can't come back if someone from outside of the community who's infectious comes into it and infects someone, but with these really strict measures, we can really substantially reduce the disease burden. In our third scenario, we're going to introduce some contact tracing. Contact tracing is a method by which people who have either been confirmed to be cases or potential cases or persons under investigation, PUI, will be contacted by people who work for the Department of Health. And they'll identify all the people with whom they've had contact and then reach out to those people to see if they have symptoms, let them know that they should be vigilant about any symptoms that they may develop, and also encourage them to get tested. And each city and each state are going to have different guidelines around contact tracing. I'm not entirely sure what each of those measures are at the moment, but once they're published, I'll certainly be reading up on them. Here we are once again on day 1. Individual 2 is infectious. By day 3, patient 2 feels ill, and so they contact their doctor's office. The doctor recommends that the patient come in for a test and they self-isolate. Now, they sure have already infected patients 4 and 3. Patient 1 is yet to become infected. Now on day 4, patient 4 has become infectious. And that leads them to passing on the virus to patient 1 on day 5. But for patient 2, their test happens to come back positive. So a contact tracer requests a list of their contacts, and the contact tracer recommends that the entire family self-isolate. Now, it's unclear whether contact tracers will begin their investigation once they receive a positive test or once someone becomes symptomatic for something like this. It's not clear to me which protocol they're going to use, but you can see that it does take some amount of time for the tests to come back. I'm estimating that it's around 2 days. That could potentially be 1 day, or with more rapid tests, for example, an antigen test, which might be a point of care test. That test result might come back much sooner than 2 days. So all of this sort of plays out depending on the accuracy and speed at which these tests can be turned around. So the entire family is now isolated, and therefore we break the connections to outside of the community, which means that patient 1 can't go on to infect patient 10, and patient 3 can't go on to infect patient 7. So let's look at a slightly different version of contact tracing. We'll call this contact tracing 2. Now in this scenario, everything plays out as it had before. However, on day 3, patient 2 does not contact their doctor. This family doesn't have health insurance, and they don't want to bother with having to pay out of pocket. So that really prevents this family from going and seeking medical care. On day 8, individual 3 still passes this virus on to patient 7, our bartender. On day 12, individual 1 passes this infection on to individual 10. But on day 13, a couple of things happen. First, the bartender feels ill, and thankfully the bartender does have health insurance and contacts their doctor. The doctor recommends that that patient come in for a test and that they self-isolate. At the same time, patient 2 becomes so ill that they require hospitalization. So whether or not they have insurance, they're getting picked up by an ambulance and being sent off to the hospital. So both of these events involve the healthcare system to now suddenly know that there are 2 cases of potential virus in their community. The entire family in this case is asked to quarantine because there is a severe case which is much more likely to be this respiratory illness. On day 15, the test for patient 7 comes back positive. Contact tracer requests a list of contacts and recommends that the family self-isolate, which they hopefully were already doing. And so we can still sort of prevent infection from spreading through this community through the use of contact tracing. The contact tracers track down the contacts of individual 7. They ask about symptoms and contacts for each of the contacts. Patient 3 informs the contact tracer that their entire family is ill, including this patient 2. I have it written here as patient 1, but the patient 2 who is oh, no, patient 1 is the student, right, including the patient 2. So the contact tracer contacts the school to inform them that there's a potential case in their community. The family cluster and the bar cluster are epidemiologically linked, and so we have an idea that all of these cases are coming from a connected index case. On day 13, patient 12 feels ill, but they know that they're at risk from patient 10 because of the efforts of contact tracing, and also from patient 6 from the bar cluster. And so that individual alerts their office that they are ill and that they have been potentially exposed to this virus. So the office winds up shutting down, and so it sort of prevents people further downstream from becoming infected. So with this, we still see that a larger number of people have become infected than in the first contact tracing scenario, but we've still been able to protect people downstream from this, keeping in mind that everyone in that office setting has their own families and friends and social structures that we're not showing in this graph that they could have potentially passed this on to. So it's important to keep in mind that infections can spread really rapidly through connected networks, and that pre-symptomatic transmission means that we need to be incredibly vigilant. Moving forward, as we open up our communities, we all as citizens need to start keeping a record of the people with whom we're spending more than 10 minutes in close contact. When we're going out for our barbecues this weekend, limit the number of people that you're in close contact with. Practice that social distancing 6 to 10 feet away from each other. Wear your masks, but keep a record of the people you're spending time with, just in case you need to go back in time to inform contact tracers, everyone that you've been in touch with. It's also important that we start to limit our contact with external networks. You want to keep a closed group of friends and practice social monogamy. I've heard some people referring to the small cluster of people that they're spending time with as their quarantine. I think that that's a really good idea, especially moving forward. We don't need to continue being socially isolated from one another, but we don't want to go back to a situation where you as an individual are going to hang out with 5 or 6 different friend groups. Importantly, stay home if you feel ill and encourage your employees to stay home if they're ill. We need to have every employer offer health insurance and every employer offer sick paid leave. I know that makes me a communist, but it's really good public health practice, because if it's the choice between going to work when you have a little cough and or making money, most people are going to choose making money. And that's, unfortunate, but this is the world that we live in. Finally, if you're contacted about someone you know being infected, listen to the advice of doctors and contact tracers. Isolate if you can. All of this work coming together is going to help us prevent future lockdowns. It's also important, people have been asking me a lot about the second wave, and whether or not there's a second wave really depends on how well we can manage this right here. We need to keep our number of infections down so that our contact tracers aren't overwhelmed with the amount of work that they have to do. But we also need to, come together as communities and work as hard as we can to keep each other safe. That's all I have for today. I hope that this has been helpful to you to start imagining the world from a social network perspective, so that we can really continue to mitigate the number of infections that we see.